In starting the arrangement of posterior teeth, it's important that we know where the crest of the ridge of the mandibular arch is on both sides. So an easy way of starting that is just to put a mark on the cast back on the heel behind the retromolar pad of where the center of the ridge would be. Once we have done that, then we can put our base plate with the anterior arrangement on it back in place, and we can extrapolate now down the ridge through the canine and put another mark on the labial, on the land and the labial region. Do the same on the other side and put a mark on the labial, on the land area, so that now the point between this point and this point should represent the crest of the alveolar ridge. So in placing our teeth, the object is to get those teeth placed in such a way that the central groove of the posterior teeth is going to be directly over the crest of the ridge. And that's what we're looking for on both sides. Another neat thing that we can do with them, and we'll check this out after we're finished with the arrangement, we'll see that this works also, is that if we form a triangle between the lateral and medial parts of the retromolar pad, and that the apex of the triangle being out where the canine is, then the majority of all the occlusal surfaces of that mandibular arrangement of teeth should fit within that triangle as we see it right there. So after we're finished with the arrangement, we'll check and see if that came out that way. In the arrangement of posterior teeth for non-anatomical occlusion, it is important that we not only control the vertical plane, the plane of the occlusion, but we also need to control the occlusal surfaces and keep them on a very flat plane so that we do not have curvatures in them, either in an anterior, posterior, or a lateral direction. The occlusal surfaces of all of those posterior teeth should be perfectly flat. Before starting to arrange the teeth, the next thing that we would like to do would be to check with our posterior teeth, and we don't want any portion of these posterior teeth to be on the upward slope of the ridge. So what I'm going to do is I'm going to put a mark on the facial which is even with the distal of the canine. And now I can remove that base plate, and let's see if we put the mesial of the first premolar where that would come out. As we can see, if we use the first premolars and we have the mesial on where that mark is there, which would be the distal of the canine, this tooth is too far back. It's on this upward slope of the ridge, far too much. So let's see what would happen if we eliminate one premolar. And we bring it up to where we're eliminating one premolar, and now that's much closer. We can see the distal of the second molar now is about here, which is slightly on the uprise of this ridge. But this being such a resorbed ridge, we would somewhat expect that, yes, we couldn't stop occlusion all the way up there. We wouldn't have anything to occlude with. But reasonably, we could put one premolar and two molars in. Whenever you have the opportunity to eliminate a tooth, the one that we usually like to eliminate is the first premolar. So in this arrangement of teeth, we're going to be using first premolar and first and second molars only, with 3 posterior teeth in each quadrant. The next thing we wish to consider is the height of the occlusal plane. Now, the occlusal plane is going to start with the tip of the mandibular canine, and it's going to end up, if we have it properly arranged, about 2/3 of the way up the retromolar pad. And as we can see, what we have here now is the occlusal plane, as on the wax rims, is pretty good in that it starts with the canine and comes all the way back as just a straight line back, and it should end up about 2/3 of the way up the retromolar pad, and that seems to be where we are. So with that, we can start arranging the posterior teeth. In order to keep the teeth perfectly flat, we're going to use a TrueBite occlusal plane guide, which is just a very flat piece of metal. It is perfectly flat so that if we lay this on the occlusal surfaces after they were arranged, every cusp of every posterior tooth should touch this flat plane. So we're going to start the arrangement by removing a wedge of wax from the mandibular first premolar area. And we're going to pull that wax. By pulling the wax in the area where we would like that first premolar. Once we have the wax pulled, we're going to place the tooth now. And we would like, if at all possible, to keep that occlusal plane perfectly flat and starting with the height of the mandibular canine. Get the tooth perfectly flat, which means both buccal and lingual cusp are touching the tooth. And in addition, from an occlusal view, the arch form that we started with the anterior teeth should continue with the buccal cusp of the posterior teeth, and that's doing that quite well here. And starting out, it will be this buccal cusp coming right in, falling in alignment with the arch form that we started with the anterior teeth. Now we're going to pull wax for the mandibular first molar. We're going to remove enough wax so that we'll have space in there to place the tooth. Pull the wax again. Once we think we have the wax softened enough, then we're just going to place that tooth, making absolutely certain we have the correct buccolingual position of the teeth, as well as keeping both cusp, all cusp of that posterior tooth, that first molar, on the flat occlusal plane. And so we place the tooth where we think it belongs, and we take our occlusal plane guide. And with that occlusal plane guide, we mash the tooth down to get it into position and check to see that all cusps, both buccal and lingual, are touching. And that seems to be pretty good. Now we're going to remove wax for a second molar. Pull the wax in the vicinity where we would like that second molar to be arranged. Once we have the wax pulled, again, place the tooth. Get the wax pulled quite deep enough, and that's why I'm having problems arranging that tooth. So we'll pull it a little more out here on the buccal. And again, with the occlusal plane guide, we're going to check and mash that tooth into position so that all cusp touch the occlusal plane guide. That seems to be in pretty good condition, except this tooth is a little bit out to the buccal, so I'm just going to mash that tooth lingually just a little bit, try to replace it lingually just a little bit, and again check the occlusal plane to make sure that all cusps are touching it. We seem to be in pretty good condition with that. Now we can go to the other side. Before we go to the other side, though, let's check on ourselves. Let's see if the lingual grooves or the central grooves of these posterior teeth are roughly directly over the crest of the ridge. And we do that by placing the straight edge between the marks and see where they are, and yes, they do turn out pretty good. Those central groove is directly over the crest of the ridge. The text tells us that if you need to, so to speak, cheat just a little bit on the position of those teeth, it's better to bring them slightly buccal than it is to take them too far lingual. And the reason for that is that if you take them too far lingual, it impinges upon the tongue space and the patient will have some difficulty with speech. I found, however, that in 99.9% of the cases that I do, if I keep them directly over the crest of the ridge, it works very well. Now we're ready to arrange teeth on the opposite side, and we'll start with, again, removing wax in the area of the second premolar where we want to place the second premolar, remembering that we're eliminating first premolars from this arrangement. So again, we'll pull the wax soften that wax very, very soft in the area where you wish to place the tooth. And we place the tooth keeping the buccal cusp in alignment with the anterior arrangement, checking it with our flat plane occlusal plane guide, and see to it that both buccal and lingual cusp touch the occlusal plane guide. Once that is in position, the tooth is in position, now we're going to stabilize that tooth just a little bit by melting some wax around it and allowing that tooth to stabilize just a bit so it doesn't tend to move on us. And now we're ready to remove wax from the molar area where we're going to place the first molar. Once we have the wax removed from there, again, we're going to soften the wax in the area of the first molar now. And we think we have it softened enough to it will hold the tooth, and we can move the tooth around to where we want it to be. And we place the tooth in the area we would like it to be, checking our alignment as we go, using our flat plane guide to see that we're keeping it on a flat plane, and we find that the lingual cusp are a little depressed right there, so I'm going to lift the lingual cusp a little bit. Now they appear to be aligned properly, and we'll go on and pull wax. Remove a little bit more wax for the second molar on this side. Soften the wax very carefully. Get it soft enough that we can manipulate the tooth into its correct position. And place that second molar now in its correct position, checking it for its buccolingual position and its relationship to the occlusal plane. And it seems that that's in very good shape, except it's a little twisted, and so I'm going to readjust those, both molars, just a little bit. Keep from having that twisted look to them. And now that appears to be in good shape as far as the occlusal plane and all is concerned. The next thing I want to do with this is I want to stabilize all of these teeth and allow that wax to set till it's fairly hard before we attempt to place maxillary teeth. And the reason for that is in placing the maxillary teeth, if the mandibular teeth tend to move on you, you're going to mess up the entire posterior arrangement. So we're just going to stabilize it. Particularly on the linguals of these teeth, we will notice that there are some spaces there, so we need to flow some wax into that. Now we're just going to allow that wax to set until it's good and hard. And in fact, I'm going to dress this lower up just a little bit and get rid of extraneous waxes that may interfere with the arrangement of the posterior or the maxillary posterior teeth, and to dress it up to where the wax is nice and smooth and all the teeth are stabilized. Now that we've arranged the mandibular posterior teeth, we want to check and see if they meet the criteria that we've laid out. First of all, we wanted the central grooves to be over the crest of the ridge, and we marked the crest of the ridge, so let's see. And yes, if we line that up now, the mark that we placed back with the retromolar pad and the anterior mark, we see that the central grooves of those teeth are over the crest of the ridge. The same is true, a little harder to do over here though, the same is true of the other side, of the right side, patient's left side, I'm sorry. And if we line those marks up, we see those central grooves are over the crest of the ridge, maybe just slightly buckled to the crest of the ridge back in this molar region, but that's okay. The other factor that we wanted to look at is that if we placed a triangle between the canines and the lateral and medial surfaces of the retromolar pad and from the canine back, and we made a triangle out of it, the vast majority of those occlusal surfaces are going to fall within that triangle. And if we come around to the other side and we do the same thing, and we see that the vast majority of those occlusal surfaces lie within that triangle. That gives us a good arrangement for the posterior teeth. The next thing that we would like to observe would be the occlusal plane, in that if we close the articulator and we see that the occlusal plane is where we wanted it to be, and that it starts with the tip of the canine and is a straight line back to about 2/3 of the way up the retromolar pad, and that appears to be where we are. So that part of it looks good. The next thing we would like to observe is whether or not the teeth are set on a flat plane, and if we will look at those, we will see that all of those buccal cusps touch that flat plane. And if we look at the other side, we see that all the buccal cusps touch the flat plane. And in order to see the linguals, that's a little more difficult to see, I'm going to remove the mandibular base plate and occlusion rim, and we're going to observe whether or not the linguals touch the occlusal plane. And yes, there they do. They touch the occlusal plane on both sides. All lingual cusps of the posterior teeth are touching that flat occlusal plane. So we have a nice arrangement of our mandibular posterior teeth, and from this we're ready to arrange our maxillary posterior teeth. In arranging the maxillary posterior teeth, I usually go ahead and remove a good wedge of wax back to where all those posterior teeth are going to be, as I've done here. I've done it on both sides. Now I don't have to remove wax one tooth at a time. So what we're going to do is we're going to start arranging the maxillary posterior teeth, and we're using one second premolar and not using the first premolars as we did on the mandibular arch. So we're going to start by pooling the wax, softening the wax in the area where we want that maxillary premolar to be. And then we place the premolar in its position where we think it should be, and then try to occlude it and see what happens. And as we can see, I have the tooth out too far and not down far enough, but as we can also see, I'm running into base plate. So what I'm going to have to do is to cut a window for these teeth in this side. If you must cut a window because you don't have enough space for the teeth, make sure the window is large enough. Cut it palatally, in this particular case, towards the palate, far enough to allow for all those lingual cusps on the posterior teeth. Cut it far enough up onto the buccal that you can accommodate the collars of the teeth without having to grind on the teeth, if at all possible. Once you have the window cut, you take some base plate wax, and we're going to soften some base plate wax and just form enough of a little form enough wax so we're going to place it down into where we cut that window and just replace the wax that was removed before we had to go do the window. And so we're just going to mash that in place like so. We can take a knife and get rid of excess wax. And now we're ready to arrange teeth again. So we're going to pool the wax in the area of the maxillary premolar, remembering we're using second premolars and not first premolars because we're only putting 3 teeth in each quadrant. So we pool the wax, take our second premolar, place it into the wax, and start checking occlusion. Now, we have a little more horizontal overlap of the canines on this side, so by necessity we'll end up with not an awful lot of lingual cusp contact on this tooth. And it appears as though we may still have a little interference, and we do. We can see right there that that tooth still will not go in place well enough because of interference. So what do we do then? We've cut a window. We can't cut on the cast to get it in there, so we're going to trim the tooth down in the area, which would be right in here. We're going to take a handpiece, a slow-speed handpiece, and an acrylic burr, and we're going to trim the ridge lap of the tooth enough so that it will accommodate it. We noted from where the interference was in the wax that it was this general area of the tooth that needed to be trimmed, so we just take a slow-speed handpiece and an acrylic resin burr. And don't drop the tooth as I did that one. And we trim the ridge lap of the tooth. Now that we've trimmed the tooth, we can go back to the articulator now, pull the wax in the area where the tooth belongs, and hopefully now we can place the tooth without interference. So we gently place the tooth into the wax and close the articulator to see if we're getting a proper occlusion. It needs to go a little farther lingual than what I have it, just slightly. Now let's see what we can do now. There we go. Except the tooth is not flat. As I'm looking at it now, I'm seeing that the lingual cusp is up too far and the buccal cusp hanging down, which means that we probably still have a little bit of interference. So let's remove the tooth and see. No, I don't see an interference from the tooth. Yes, I do, just a little bit. Right there. There's just a tiny bit of interference. So I'm going to be doing a little bit more trimming. Now that we've trimmed the tooth, we're going to pull the wax once again, attempt placing it into its proper position, close the articulator, and see if it'll go all the way in place without moving the tooth. That looks pretty good from here, because we have a little excessive horizontal overlap of the maxillary canine to the mandibular canine. We're going to end up with not much tooth contact on the first premolar, but that will come in with the second molars, or the first molars and second molars, quite nicely. So we don't really have to worry about that. This makes for a nice transition using non-anatomical teeth, we can use this transition like this. If that were anatomical teeth, those would not arrange like that. We would have to change our anterior arrangement to make it come out right. But with non-anatomical teeth, we can have a little excessive horizontal overlap in that premolar area if it is necessary. So now we're going to pull the wax once again, soften the wax in the area where the first molar should be, and see if that'll go in without interference. So we take the first molar, we place that into the wax, into approximate position where we think they should be. Close the articulator. The lingual of that is not in quite far enough because that buccal cusp is hanging down a little too much. And we can see we have an interference right there, which means that we're going to have to trim a little of the collar of that tooth off, just a little bit on the first molar. As we could see where the interference was in the wax, it was the collar of the tooth, which is right along here. Okay, and we can see the collar of the tooth, so there's a little excessive material there that would not allow us to set that tooth all the way, so we're just going to trim the collar of that tooth down. Enough so that tooth should go back in place. So now we're going to pull the wax again in the area of the first molar. We need to add just a little extra wax here, just right in that area. And now we're going to put that first molar, as it has been trimmed, we're going to place that into it now, and hopefully we have enough room to place the tooth without interference. And that seems to fit in quite well now. We have good occlusion of the maxillary and the mandibular. The tooth seems to be in the correct position. So now once we have that tooth in position, we're going to pull wax for the second molar. We will attempt again to place the second molar, hopefully without interferences. That's in a little bit too far. We don't have any horizontal overlap to those teeth, so I'm going to rearrange them just enough to see if we can get nice horizontal overlap. It's still not enough horizontal overlap, so we need to move out the alignment of the first molar just a little bit and of the second molar just a little bit so that we can have a sufficient amount of horizontal overlap. It's good on the first molar. The second molar is not quite there, so I'm going to pull that wax a little more, soften it so that I can work with that tooth a little more and get it to the point to where the occlusal plane is flat and we have good contact with the mandibular molars without interference. So we get the tooth roughly in place and then close the articulator. And I don't like the way that occludes, so I need to remove that wax, add a little more wax to it because don't have enough wax to support the tooth is what the problem is. So we'll get a little more wax on it. Put a wedge of wax in this time and soften that so that that molar will go in there and be held firmly in place. Okay, we pull the wax now. Now we're getting to the point to where we're getting good occlusion with that. We also have a good horizontal overlap to the teeth. That horizontal overlap should be approximately 2 to 3 millimeters. That's in order to keep the patient from chewing their cheek in the finished product when the dentures are delivered. So at this point, that quadrant looks pretty good. It may have just a little excessive right there. And we can stabilize those teeth right there. That quadrant looks pretty good. So let's stabilize the teeth by flowing wax around them. And we'll stabilize them on the buccal a bit. Flowing this wax in. And then we'll check occlusion once again to make sure that we haven't moved anything. And it looks pretty good. And then we have about a 2 to 3 millimeter horizontal overlap of the posterior teeth. The teeth are nice and flat and occluding with the lower teeth in a good form. And also when we look at it from the occlusal view, we'll see that the buccal cusp follow our arch form as we come around. And we look at it from the mesial like this, we will see that the canine turns the corner with the buccal cusp of those posterior teeth falling into the arch form that we've established with the anterior arrangement. We now have all of the teeth for this arrangement arranged and in the occlusion that we would like it to be. Notice for non-anatomical occlusion or flat plane occlusion, we've kept the incisal guidance at a very, very shallow 5 degrees or even less of incline for the incisal guidance. And that leaves us almost just an end-to-end or as far as vertical overlap is concerned, virtually no vertical overlap of these anterior teeth. We also want to notice that in an arrangement of the posterior teeth that we have provided in here about 2 millimeters of a horizontal overlap. And in this particular arrangement of teeth for this particular patient, this turned out to be a normal arrangement of the posteriors in that the maxillary teeth overlap the mandibular teeth by 2 to 3 millimeters. Also, notice that we selected simply because of the size of the arches and where this posterior part of the ridge started its ascent. Since we didn't want posterior teeth on this vertical ascent of the ridge, we limited the arrangement of posterior teeth to 3 teeth in each quadrant. That's a second premolar and 2 molars in each quadrant. And we have the same arrangement on the other side with 2 to 3 millimeters of horizontal overlap and 3 posterior teeth, those being second premolars and 2 molars in each quadrant. We also need to pay attention to the fact that the teeth are over the ridge, in that if we project where the residual ridge is on this particular patient, the central grooves of all of these posterior teeth are over the ridge. That's true both for right and left side. We also would like to take a look at the linguals of these teeth. And when we look at the linguals, we need to observe that we have maximum contact of both the buccal and lingual cusp of the teeth on each side on the 3 posteriors that we've arranged in each quadrant. And when we look at the contacts between the maxillary and mandibular teeth, we have both lingual and buccal cusp contacts, and that we have the maximum amount of contact of the occlusal surfaces of the maxillary teeth with the mandibular teeth.